Hey everyone, Dr. Harmon here. I'd like to talk a little bit about where fat is most commonly placed in the face. A fat transfer is a procedure where fat is harvested from an area of the body, the abdomen, the thighs, the flanks, processed so that the fat cells are isolated, and then transferred to an area of the face where volume was lost or where there was poor volume in the first place. There are really two areas where fat is most commonly transferred. The first is the temples. As we get older, we often lose volume in the temples, and that can impart an aged appearance, especially from the transition from the temples to the sides of the eyebrows. You want volume there, you want volume in the sides of the eyebrows. It imparts youthfulness to the face. And so fat can be a really nice option for individuals who have lost that volume. The cheeks are another common area, and that can be for an individual who has lost volume with age, which is not most people, but some, or for an individual who never had volume there in the first place. The transfer, the technique, they're similar. It's important to target the right depth and to smoothly spread that fat out so that you get an even appearance. But I'd also like to mention that in the cheeks specifically, there really is no replacement for lifting the face's native fat that had fallen in the first place with age. When you add too much volume to the side of the cheek and you've left the volume that has dropped down into the center, accentuating these nasolabial folds and filling this area of the cheek that doesn't normally have a lot of volume, then you can get a bit of a chipmunky or overfilled appearance that looks unnatural. And that on top of the risk of having lumpiness when too much volume is added to the side of the cheek up high, it imparts a look that is not desired by most individuals. So fat in the temples, fat in the cheeks can both be really good as long as the proper technique is utilized and as long as it's for the right patient.